Well, the pandemic interrupted a lot of life, including regular trips to the doctor for routine appointments. That's why health experts are reminding parents to get their kids up to date on their vaccines. KPX5's Max Darrow has that story.
As we head into a new school year, new numbers from the California Department of Public Health reveal more than 1 in 8 kids need to catch up on their routine vaccinations, as many of them fell behind during the pandemic. The state's DPH isn't referring to COVID-19 vaccines. These are the normal childhood vaccines against tetanus, polio, chickenpox, measles, and more that have been required for kids to go to school for years.
We need to make sure we get our numbers back up so kids can be safe.
Dr. Yvonne Maldonado is a pediatric infectious disease epidemiologist at Stanford.
These vaccines are incredibly effective and safe for our kids.
She says some kids fell behind because they couldn't get to the doctor regularly during the pandemic. However,
we are worried about in certain parts of the country and certain pockets, even in California, where people have just kind of lumped all the vaccines and all the interventions with COVID together with, well, I don't want anything. Nobody can tell me what to do. And that's a real concern.
Maldonado says at 1 in 8 kids needing to get caught up on their vaccines, the vaccination rate is just a bit below the norm, but it's important to get back to normal.
I think we're going to get back up to normal numbers again, but it's going to take a little more work for us to really talk to families, make sure providers can catch up with those kids who didn't get their vaccines during the pandemic.
Her big concern, if more and more kids fall behind rather than catch up.
That we could go back to a time when children are getting sick, hospitalized, and even dying from diseases that we thought were gone from the United States.
In San Francisco, Max Darrow, KPIX 5.